And then we have bladder 23. Now, bladder 23 is shenshu, is the back shu point of the kidney. And clearly it's in relationship to what I'm saying is a whole zone that corresponds with water. But also with earth. This kind of gives you a little bit of an insight into how you can use some of these back shu points in a slightly expanded way, or with an expanded thinking. When we needle bladder 23, very often it's in concert with kidney 3 and points like that to work with the tendency towards swollen ankles, towards water retention, right? We're dealing directly with kidney functioning. Now, in kidney functioning, once you start getting water retention and swollen puffy ankles and puffy legs and so on, you're dealing with earth being unable to soak up water, right? It's water, yes, but it's also a dynamic interaction. In the Kerr cycle, clearly the cells of your body are unable to actually soak up the excess water, right? This is a sort of between spleen and kidney terrain, and I would suggest that you have a particular ability to access that from bladder 24, right? I'm bladder 23, excuse me. Let's talk about bladder 24. So bladder 24 is at the lower border of L3. Now, according to my schemata, I'm saying that corresponds to earth, okay? That's not in anybody's textbooks. I'm just going to put that out there. We know that bladder 24 is commonly called Qi Hai Shu. Right? This is the back shu point of Qi Hai, the ocean of Qi point. Now, I'm just going to throw out to you the idea that you could use bladder 24 to connect a little bit to something else. L3, if you look at the structure of the body, you'll generally find that L3 corresponds to the lower part of the lordosis of the lumbar curve. So in other words, if somebody's lying, say, face down, the lumbar curve is going to curve inwards, right? And when you hit the bottom of the lumbar curve, will very often correspond to a little roll of fat, right? That's why you locate the level of L3 by putting your hand on that sort of fat pad that sits on top of the ASIS. And you've got this little fat pad that goes around. It demarcates the level of L3. It demarcates the navel. My suggestion to you is that is simply a way to access the daimai. But that's a very specific daimai type of energy. Now the daimai is described as traveling to the kidneys and to Ming Men. In where is it described that way? I think by Li Shejian, by some of the later commentators on the Eight Extraordinary Channels. They describe the daimai as wrapping right around to the Ming Men and to the kidneys. And I would suggest to you it actually wraps around to L3. It also, of course, connects to the navel. And so, Qi Hai Shu, it connects to that point, CV6. It's simply named after CV6. CV6 is this little fat pad, this little pouch of flesh that everybody has right kind of underneath their navel. And the exact location of it will vary from person to person. But in Qigong theory, Qi Hai is where your Qi is actually held, where it's actually kind of glued into your body. And Qigong theory spends a lot of time being concerned about strengthening that Qi Hai area. Let's keep going. Let's take a look at the next point down. So the next point down is bladder 25. And bladder 25 is at the level of the lower border of L4, which means it's between L4 and L5, and therefore its influence will cover both L4 and L5. Bladder 25 is the back shu point of the large intestine. And the large intestine is a metal organ, and clearly we've got a zone that I'm going to suggest to you corresponds to metal, but also bladder 25 would connect to wood. Now I think it's important to think about this a little bit. The interrelationship between wood and metal in relation to the function of your large intestine. Bob Floors wrote an interesting book about 15 years ago called Scatology and the Gate of Life. It's a great book, actually, really, I think one of his best books. And in this book, he points out that there's a variant tradition in TCM, and this variant tradition suggests that your Wei Qi is actually generated by your large intestine inside your lower dantian, right?